Hello, I'm Dr. Margaret Merrick, and today we're going to be talking about the revenue cycle A to Z, what it takes to get paid for a single insurance medical visit. By way of introduction, let me tell you a little bit about myself. I'm a pediatrician. I finished my medical school and residency training in 1983, and I've been in private practice for the 27 years since then. I'm married to an internist and geriatrician. We were in the same med school class. My husband still has a busy internal medicine practice, and because of his specialty in geriatrics, he sees quite a few Medicare patients. About 8 years ago, I also co-founded a medical business consulting group, and we work with practices to help doctors and their staffs optimize their billing systems and learn about insurance billing and collections. Let me explain what led us to make this video. And I'm going to refer to notes throughout our presentation so that I won't forget an important step. In most businesses, the consumer purchases a good or a service and either pays for it at the time it's purchased, or the business bills the consumer directly. A medical practice differs in that we have an additional element to contend with, and that element is insurance. Insurance contracts and rules dictate the way that medical practices have to bill first the insurance company and then the patient. Now, because of the insurance contract, our fees or our prices are locked in. And because of the lock-in, which is called the allowed amount, a doctor's office doesn't have the ability to raise fees if our overhead goes up. So that's one important way that we differ from other businesses. Now, over the last year, there's been a lot of talk about healthcare reform. And in that debate, we've heard some of our officials express their belief that by making a doctor's office more efficient, the cost of health care will decrease. Now, I've wondered, why are people thinking that doctor's offices are inefficient? And from our consulting team was talking about this, and from our perspective, doctor's offices are already extremely efficient. We have to be in order to get paid by insurance companies. We don't believe, though, that most people, including our elected officials, understand the many steps it takes to get paid by insurance. So we decided the best way to tell our story was to make a video. We've recruited a real live doctor's office with a real live patient, and we're going to walk you through the steps it takes to get one single visit paid for by insurance. So, there are 42 steps that have to be taken. I think you'll find it an eye-opening video, and guess how many steps involve the doctor? We'll tell you that at the end. Next, we're going to go meet our patient. Meet our patient, Mrs. Barrett. Mrs. Barrett, thank you for participating in our video today.
You're so welcome.
And I'm sorry you're not feeling well.
Oh, well, thank you.
Could you tell our viewers why you're here today?
Well, I have diabetes, and I've been experiencing some shortness of breath.
Well, we're going to get you seen right away.
Okay.
But for a few moments, I'm going to explain to our viewers some aspects of what it's going to take to get your Medicare insurance to pay for your visit today. Before we can even begin to see Mrs. Barrett or any other patient, there are 9 steps that we need to take as doctors to just get the doors open and to keep them open. Some of these steps have to be repeated periodically. Step 1, of course, is we have to attend medical school and obtain our MD or DO degree. Then we take 3 to 5 years of residency training in our specialty. Once we graduate from residency training, we then take 2 years to study and achieve our board certification in our specialty. And then we go to step 2. obtaining our medical license to practice in North Carolina. That was a process that took my husband and me about 6 months to go through the application process and become licensed physicians in North Carolina. The average new graduate physician in North Carolina completing med school and residency has $200,000 in student loan debt. So as part of step 1 and 2, we had to arrange financing for our loans and then make plans for repayment. Step 3 is to have a physical location in which to practice, in which to see the patients, which means securing an office. That means, of course, either renting an office or building a building. And we started out by renting, and then we built a building about 10 years ago. Commercial rent ranges from $14 to $20 a square foot for medical office space. And then step 4 is contracting and credentialing with the insurance companies. When we decided to participate in Medicare, we had to submit lengthy applications. At that time, there were 4 applications involved, and the contracting and credentialing process with Medicare takes anywhere from 60 to 90 days if each application is completed correctly. So those are 4 of the first 9 steps. And now we're going to leave you for a moment while the nurse comes in and takes your vital signs, and we're going to go speak with our office manager about the next 5 steps.